doing health and social research. So Obindra, really happy to have you with us to talk about the COVID situation with people with disabilities in Nepal. Thank you.
Thank you very much. Thank you very much, Karen. Good afternoon, good evening, wherever we are. Thank you for your kind introductions. I am Obindra Chand, anthropologist by training, work as a health and social science research at the HERT International, which is health research and development institute based in Nepal. Work with different collaborators, including government and different universities. Today, I am going to discuss about how COVID has made a differential impact on the people with disability while living through the COVID for the last 2 years. As we all know, approximately 1 billion people live some form of disability across the world. The number of people with disability in the Asia and Pacific is 650 million, while this is over 500,000 in Nepal. Historically, people with disabilities have been facing several challenges, including social, cultural, structural, and political. And the absence and the discrepancies of the data in exploring and better understandings of the issues and the concerns of the people with disability is largely lack, mostly in the case of the low and middle income countries, including Nepal. As we can see, some of the national representative data in Nepal shows quite discrepancy. However, we cannot exactly compare and contrast the data, but we can have discrepancies and differentiations in the national level data as well. For instance, the Central Bureau of Statistics, which is conducted in 2011, shows that approximately 2% of the total population lives with some form of disabilities, while National Living Standard Survey shows over 3%, while another study which known as the nationally representative study and used Washington group of questionnaire to screen the disability, claim that the 15% of the people are living with a disability across the country. I'll give some political context. Nepal promulgated the constitutions in 2015. With that constitutions, Nepal changed its political systems from unitary to federalizations, and in the federalized context, Nepal operates in the three tiers of the government, starting from federal to local, provincial in between, and health system also operates in the three tiers, and the local government is primarily responsible for delivering health facilities and services to the people living across the countries. But when we talk about the access of the essential healthcare services for the various kind of vulnerable and marginalized group of the people, including people with disabilities, one of the health systems issues is inaccessibility, and this is more pregnant in the remote areas compared to the urban. And as we all know, pandemics, humanitarian crisis, war, health emergencies exacerbate the issue, conditions and the concerns of the people with disabilities. As the previous as it was in the previous pandemic influenza, people with disabilities were disproportionately impacted, and the case is true in the COVID-19 as well. Unfortunately, the stories and experience of The people with disabilities remain untold and unexplored for the various reasons, which I discussed earlier as well, and I'll explain further as I go through. Considering the context and the concerns of the people with disabilities, various national and international policies are formed and endorsed. The common one, as all of us know, that the UNCRPD, which UN endorsed in 2006, and the Article 11 of the UNCRPD explain that the country should take appropriate measures to ensure the protections and the safety of the people with disability in different contexts, including humanitarian crises, health outbreaks, emergencies, and pandemics. Nepal signed the UNCRPD in 2010, so Nepal is officially obliged to protect and ensure the needs and requirements of the people with disabilities living across the country. Similarly, in the post-MDG context, Sustainable Development Goal promulgate, and Nepal also as a member of the a signatory of the SDGs, which drive the cross-cutting principles of leaving no one behind and universal health coverage. At the national context, Nepal endorsed the legal issues to address the issues and concerns of the people with disability in 1982 with the Disabled Protections Act, which have various provisions to ensure and address the issues and concerns of the people with disability, including free medical examination services for them. And in similarly, that follows the subsequent policies and programs and legal frameworks to promote the rights and dignity of the people with disability living across the country. In 2015, as I mentioned, the new constitutions has guaranteed the equality of the treatment, including irrespective of the socio-demographic characters and physical conditions. Similarly, in 2017, Nepal endorsed the Disaster Risk and Management Act, which was aligned with the Sendai framework, and Sendai framework is known as the comprehensive document to mitigate the risk reductions of the various vulnerable groups, including people with disabilities living across the world. Similarly, in the emergence of the COVID-19, the government of Nepal endorsed the health sector emergency response plan, which also has a provision for the people with disabilities to address their needs, including accessible facilities for the quarantined and isolation centers. But the absence of the effective implementations has made the everyday life of the people with disability even more complicated, and the lack of a skilled human resource and accessible health systems at the local level made it more challenging for them. Method for this was I closely following the issues and news on the media, listening and interacting with a diverse group of people with disabilities and their narratives and stories while living through the COVID-19, engaged in writing op-eds, blogs, on the issues and concerns of the disabilities and reflecting on the anecdotal and experiential informations and linking it to the policy plannings and other concepts. And as Shani mentioned, lived experience. And even in the pre-COVID era, people with disabilities were facing environmental, I'm meaning here social and physical, financial, of course, and personal barriers. Personals is self-stigma and hesitations, discouraging and demotivations due to several factors that have compounded their situations. The risk of violence is reported higher among the women with the disability compared to their non-disabled women counterparts, and essential health services was largely inaccessible for them even before COVID. So one of the study had shown that over 54% of the respondents reported that the nearest health facility is not compatible to their disability. During lockdown, they struggled to fulfill their essential healthcare services. As all of us know that COVID-19 has exacerbated the situations of the people with disability in Nepal and elsewhere. Ministry of the Health and Population introduced the sign language features in the daily media brief, and the Ministry of Health and Population and Epidemiology and Disease Control Division collaborate with other INGOs or donor develop a 2-minute awareness program with the accessibility features on it to promote the COVID awareness and prevention among this group. WHO explained that people with disabilities were in the greater risk of contacting COVID for several reasons, including physical barriers to access the hygiene facilities, need to touch the things, and difficulty in enacting social and physical distancing, and difficulty of accessing informations, as many of the informations were not accessible to the diverse group of the people, diverse group of disabilities. The situations was obviously worse in the first lockdown, which was enacted in March to late August 2020. The hundreds of the people with hemophilia experienced shortage of the essential medicines. Many wheelchair users were not able to access the assistive device, so they were compelled to use the same device longer than it was prescribed, and several adolescent women who were in their reproductive age were finding difficulty to access sanitary pads, which not only made adverse impact on their health and personal hygiene, but also in mental health and psychosocial aspect. Lockdown has interrupted. One of the studies shows that lockdown has interrupted the regular health services for over 45% individuals, and over 35% of them affected were receiving inadequate health services, either completely interrupted or inadequate health service. And this added more challenges to the parents of the intellectual disabilities, who were even regarded as underrepresentative group within the wider spectrum of the people with disability. Right. Okay. Inaccessible health system accessibility remains a major issue. Over 40% of the people with disabilities were unaware of the basic informations about the COVID preventions and contract transmissions, and over 5% were completely unaware about uh, it due to the inaccessible lack of accessible informations to them. And nearly 60% of the PWDs who were in the less known category or totally unknown was belong to uh, profound disability or the severe disability. The government of Nepal categorized the people with disability based on their severity on 4 different categories, which stands for mild, moderate, severe, and profound. And anecdotal and experiential evidence suggests that the relief packages were inaccessible for the majority of the people with disabilities, and it was inappropriate for them. Many of the narratives that time during lockdown was, instead of well and rice, we were in real need of sanitary pads and regular medicines. Perhaps government has to prioritize while providing relief package. And similarly, several disability right activists informed that several PWDs did not visit to the hospitals or quarantine centers due to its inaccessibility, thus stayed at homes facing multiple practical and mental health issues, even if they were infected with the COVID.
Obindra, could I ask you to wrap up fairly soon?
Okay, I'll do that. Thank you for a reminder. The study shows that total number of the people with disabilities in the lockdown, 40% of the people with disabilities lost their income source, and around 20% think that they will lose it very soon. And in terms of the gender, who lost the job was like over 48% female and 51% over 51% male. Anecdotal and experiential evidence of the people with disability suggests that they were unable to run their household expenditure, pay rent sometimes, and sometimes mistreated from the household owners. This made them vulnerable to mental health problems, psychosocial issues, but have received rare attention to the several complications, including social stigma, as both disability and mental health problems are stigmatized issues in Nepal, perhaps elsewhere. And over 62% of the individuals who do not get the relief package are deemed to be profound and severe disability groups, and had red and blue ID cards. Let me go another. This is my final slide. COVID-19 narratives has not just put several challenges, but also provided us opportunities to work collaboratively for inclusive, accessible healthcare services, to deliver the health services for all, including various group of the marginalized people, including people with disability, using intersectionality approach and multi-sectoral collaboration. Federalism has not just struggled, but it has struggled to institutionalize the federal principles. At this moment, perhaps local government and local actors could take appropriate and innovative initiatives, as the local government has authority to allocate resource, design policy, and implement interventions and programs. So if they take initiatives that would be culturally relevant, contextually appropriate, and socially acceptable. This would, I guess, not only help us to work towards protecting the fundamentals right of the most vulnerable groups, but also facilitate to meet national and global goal. With this, I'll stop here. Thank you very much.